All right. Well, I am so pleased to welcome all of you friends to this virtual dedication and celebration of a wonderful gift. My name is Rob Hare, and I'm the superintendent here at the Maryland School for the Blind. And we are partially here in person live, having a socially distanced cocktail hour and mask wearing and getting to know Dr. Wolterman and now we're joined by all of you folks here virtually. And what a strange time this is. I remember, and we were just reviewing this together downstairs. We were talking about when Dr. Walterman first called me on the phone. She reached me, I think, or reached Ruth Ann and then cut to me or something. And when I was speaking with Dr. Walterman, I realized the kind of gift that you all were making to the school. I was so overwhelmed with just joy, but and also knowing and recognizing that the mission of the Maryland Society for Sight is what an important mission, and we share so much in common, serving people with low vision and blindness and sight impairments. What a beautiful thing that you're doing for our school, in spite of the fact that the organization is dissolving. So from the bottom of our hearts, we are so appreciative to you. And I want you to know that we wanted to have something live and in person, but of course the pandemic wouldn't allow us to do that, for us all to be together. But we're so thankful to have this moment with you, to celebrate with you, and to thank you for this gift. Now, we are in the location that we are. This building houses our preschool and also our outreach services and our low vision services. So it seemed like such a fitting tribute to the work that you've done for many years in your organization, for us to take this gift and to use it to assist our students and clients that we see for low vision and in outreach services, and that this fund will, for many years, the legacy of what you've done will touch the lives of students around the state of Maryland through the work that we do here at the School for the Blind. So thank you for all that you're doing and what you've done for the school. So for introductions, I would like to point out that we have Ruth Ann Hinson here. Ruth Ann is our Director of Statewide Outreach Services. Of course, live here in person, Dr. Wolterman from the Board of Directors of the Maryland Society for Sight. Dr. Collins, Dr. Mary Louise Collins from the board is with us via Zoom, and of course has a very special long-standing relationship with the school. And so I didn't know you at the time when you were here before, but delighted that you're here. We have some testimonial videos that we will be sharing of how this service has touched the lives of students and families across the state. And then we have our board chair, Miriam Malaur, the board chair of the Maryland School for the Blind, here to make some remarks. Sharon Whited, our low vision specialist, is here as well. And then we're going to dedicate the plaque and do a ribbon cutting and as we close out the program. So without further ado, onward with the program. Thank you.
Hi, good evening. I am Ruth Ann Hinson, Statewide Outreach Director at the Maryland School for the Blind. MSB's outreach program has been serving blind and low vision students in the state of Maryland for over 50 years. Starting out on a small scale with only 2 to 3 staff and services to limited areas, the program has grown to include 19 staff serving the whole state through a variety of services provided to students, local school system staff, and parents. Our staff are highly qualified teachers of the visually impaired, orientation and mobility specialist, low vision specialist, psychologist, parent coordinator, and social worker. The services they provide include direct instruction in vision and orientation mobility, assessments, consultations, professional training, parent training, short course programs focused on skills training for students, summer programs, equipment loans, and connection to resources. Our mission is to provide the highest quality of service as possible with an emphasis on promoting independence, accessibility, and a can-do attitude with regards to the education of blind and low vision students with and without additional disabilities. We strive to achieve this in several ways: by helping students, families, and staff understand the impact of a vision diagnosis on the day-to-day functioning at home and school, by providing devices and equipment that help students gain equal access to their education and materials as their sighted peers, by providing opportunities for students to learn how to participate in their daily activities and social and recreational activities with adaptations, by preparing students at an early age for post-secondary plans and activities, and by connecting families and students together for support and socialization. This is just to name a few. We utilize a collaborative team approach when working with students, recognizing the whole child and that one area cannot necessarily be isolated from the others when addressing their needs. We also maintain ongoing relationships with students, families, and staff, recognizing that a one and done philosophy cannot address the complexity of needs that some of our students present with, nor can we effectively meet their needs by only offering services on the MSB campus. The vast majority of what we provide is offered in the local communities where students live and attend school. By doing this, obstacles are eliminated, such as distance, lack of transportation, limited income, or limited access to resources that may prevent students from receiving what they really need. Our low vision service has been an integral part of the outreach services we provide from the very beginning. By taking this service on the road 50 years ago, the awareness of the actual needs of students, families, local staff became readily apparent and led to the growth of our outreach program and services. Our low vision service still remains the primary contact that many students have with MSB. As a result of this service, students not only receive necessary eye care, but other doors and opportunities open up to them that may not have been available before. Knowing the valuable services that the Maryland Society for Sight has provided throughout the history of their organization, including vision screenings, mobile eye care, advocacy, eye and health and education programs, we are excited to be able to continue their legacy through the MSB Outreach Program. Thank you very much. And I have the great pleasure of introducing Dr. Joanne Wolterman, who is from the Maryland Society for Sight Board of Directors. And she is a ophthalmologist that we have enjoyed reading her reports over the years for many of the students that we served. Good evening, Dr. Wolterman.
Hello. Okay, good evening. I'm Dr. Joanne Wolterman, and thank you for joining our celebration. I'm the former president of the Maryland Society for Sight Board of Directors, and I'm here to give some history on the society. The Maryland Society for Sight was founded in 1910 by Mrs. Joseph Bloodgood. She was in excellent company when Dr. William Henry Welch chaired the first meeting. Dr. Welch is one of the Hopkins Big Four, along with Drs. Osler, Halstead, and Kelly. These physicians are credited with helping establish the Johns Hopkins Medical Institutions. At the same time, Dr. Welch was the Maryland Secretary for Health. The Society's goal was, quote, to promote by all possible means, the prevention of blindness in Maryland, unquote. We have adhered to this goal throughout our history. Over our 110 years, we've screened the vision of over 30,000 Marylanders and educated many more. This was made possible by our volunteers, our staff, and the dedication of our executive directors, Kathy Curtin, and for the past 25 years, Audrey Novak, who has given her all to the society. In early 2020, the board members made the bold decision to cease operations due to the declining financial support for nonprofits. I promoted you. Mr. Jonathan Ackerman an attorney specializing in nonprofit law, was instrumental in helping the society donate our remaining assets to the Maryland School for the Blind. The society closes knowing that it led the way in establishing eye health screening programs throughout the educational, healthcare, and civic communities. Our board of directors, including Dr. Sam Bowles, Dr. Mary Lou Collins, Dr. Lisa McGinn, Dr. Michael Sless, Dr. Daniel Stoltz, there is a pattern here, and Mr. Chris Trapani, elected to dedicate our remaining assets to continue our mission of serving the public. The community outreach programs at the Maryland School for the Blind were a natural choice. The funds donated today will be placed in the Maryland Society for Sight Low Vision Fund. But before we close the book on the Maryland Society for Sight, I'd like to celebrate some of our accomplishments over our 110-year history. In the 1910s, we helped pass the midwife law, which pertained to anyone delivering babies and mandated that silver nitrate be placed in all infants' eyes to prevent a blinding type of bacterial infection. In the 1920s, we focused on decreasing the incidence of blindness caused by workplace accidents. This legislation helped establish modern workplace safety standards and laws. In the 1930s, the society was asked by the Baltimore County Health Department to help screen the vision of preschoolers, students, and the elderly. This led to some of our most valuable programs: nursery school, community, and Head Start screenings. Later in the 1930s, we were instrumental in passing laws in Maryland that mandated safety glass in automobiles. And it took an additional 2 years to get it put into buses and public transportation. In addition, we helped pass laws that banned BB guns in Maryland. And in 1941, with the help and support of governmental leaders, we banned exploding fireworks from the state of Maryland. So we're stuck with sparklers. Right. A signed copy of the state fireworks legislation is displayed at the Maryland School for the Blind. These legislative actions were in addition to our day-to-day work of screening for and educating the public about eye diseases such as amblyopia, diabetes, and glaucoma. Healthcare providers and educators and school nurses benefited from talks and literature given by staff and volunteers. Our efforts covered all age groups and many diverse communities. We expanded our reach into the underserved community by purchasing a mobile medical eye clinic with funds from a private donation. This allowed our eye care volunteers to serve medically disadvantaged populations. Recently, a full exam room of state-of-the-art ophthalmic equipment was donated to the Healthcare for Homeless in downtown Baltimore. In closing, I can speak for the entire board of directors when I say that we're proud to establish the Maryland Society for Sight Low Vision Fund at the Maryland School for the Blind. This fund will hopefully continue our mission to preserve and maximize visual potential for all Marylanders, hopefully for another 110 years. Thank you.
And now Dr. Mary Louise Collins from the SFS Board of Directors.
I believe I am now unmuted. Is that correct?
Yes.
Okay, great. Thank you. Thank you for asking me to speak with you this evening. And Joanne, that was a beautiful rendition of the history of the Maryland Society for Sight, some of which I didn't know, but it was clearly an organization that served the public in so many ways over such a long time. I have a long history both with the Maryland School for the Blind and the Maryland Society for Sight. I started being the consultant to the ophthalmology clinic in 1993 when I joined the full-time faculty at GBMC. The history of GBMC's relationship with the Maryland School for the Blind goes back to Dick Hoover, who had an incredibly long history at the school. And I look back on the early days of doing those eye clinics and recall really how much I learned from the nurses and the low vision specialists who I worked with from day one. They taught me as much as I was able to bring to those clinics. And I also learned from the students. And it was a great experience. And I stayed doing these clinics until 2016 and enjoyed every moment of it. Maryland School for the Blind is a very special place. It provides an amazing educational experience for the children both on campus and helps so many in outreach, as you've heard from Ruth Ann. My patients over 27 years in practice have benefited from these services. Maryland Society for Sight has, as you've heard from Dr. Wolterman, has had a long history of working to eliminate preventable blindness in children and adults. Its mission began at a time when no one else was really doing this work, especially with children. And the Rosalie Sahlberg preschool vision screening program was so innovative and necessary. It's unclear how many children really benefited over the years from this program and had their vision saved. But over the years, many others started doing this work of vision screening and of looking for ways to prevent vision loss in patients. And so I feel that the Maryland Society for Sight's mission was really fulfilled in that way, to transfer those skills and that interest to others to continue this work. And so I feel that the mission of the Society for Sight and MSB's mission to maximize the visual potential and the educational and lifetime potential of each person who attends the school or who is touched by the outreach programs. It is quite fitting that the funds of the Society for Sight be contributed to the work of the Low Vision Clinic and the outreach at MSB to enhance the work of maximizing each child's visual potential. Thank you so much. Thank you so much.
Thank you, Dr. Collins. And now we have a few videos to share with you, testimonial videos from various families and optometrists and TVIs who would like to share with you what we do at the School for the Blind.
Hi, I am the parent of a 13-year-old who began attending MSB when he was in the 6th grade and who has a diagnosis of CVI. We lived with a lot of uncertainty and confusion and often guilt until we were finally even told about CVI at the vision clinic at MSB. In the years that led up to that appointment, my son had numerous consults with pediatric ophthalmologists. He was sent for an MRI when one doctor was certain he had a visual pathway glioma. He didn't. He was sent for genetic testing, all to try and explain these visual difficulties he was having. And despite him having a PVL and consistently testing in the 1st to 5th percentile in the vision portions of the psychoeducational testing, year after year after year, no one ever mentioned CVI. Sometimes he would get a diagnosis of visual agnosia, but that was as far as we ever got. Finally, in 2017, it was suggested that we have a consult at MSB, and I was told to call them and see if they did that. It would be impossible to overstate how much of an impact our visit that day at the vision clinic at MSB had on my life and on his life and on his siblings' lives. When we were there and we were in the waiting area, when the outreach staff approached and talked to my son, he looked at me and answered her questions like he always did. And like I always did, I scolded him and reminded him that he really needed to make eye contact with the person he was speaking to. but the staff member from MSB told me that it was probably too much visual information coming in to look at this brand new face and to think of these questions she was asking and answer them. And that seems like a simple thing, but it is not a simple thing. That's a big question. Following that appointment, he was finally evaluated by a TVI at school. He started working with a wonderful orientation and mobility provider, and eventually he ended up attending MSB. Psychologically, emotionally, educationally, I don't have the words to express how much it means to get the correct diagnosis. I mean, we waited years for that, and we were finally able to answer so many questions, and everything made sense after that appointment. So thank you.
Hi, I'm Saman Bhatti, and I'm an optometrist who became affiliated with MSB in 2013. And I just wanted to take a moment to thank the Maryland Society for Sight on their generous contribution to the outreach program. Thank you so much. I personally have seen what the outreach program can offer children with visual impairments. And the goal is always to help the child come up with strategies to help maximize their visual ability. And in order to do that, the child has to be on board. And thankfully, MSB does an amazing job at encouraging kids to embrace new strategies at a very young age and on how to advocate for themselves. And it can be overwhelming for families at times, but one of the things I love about the program is families always have access to a social worker to help them navigate through any concerns and help them figure out what questions they need addressed. And then when they come for the evaluation, they come to the outreach site. I would encourage everyone to take a look at the facility. It is a beautiful room. Everything there is strategically placed. It has a purpose, which is to see how the child uses their vision. And the goal of the assessment is always to treat the child like the stars that they are. Alongside them, you'll have the parents, and many times you'll have the teacher of the visually impaired also there to offer feedback. And it doesn't just stop at that visit. These children are followed throughout their education. They are seen a lot of times in their elementary, then middle school and high school years. And for those children that can't come to MSB, another really nice feature opportunity is that MSB can actually do regional clinics where they will go out to the child at the school to do these assessments. So MSB does an amazing job at what they do. And again, I just want to thank the Maryland Society for Sight on their generous donation to the program. Thank you so much.
As a teacher for the blind and visually impaired, it's important for me to have resources available to support my students through their educational journey. One such resource for me is the Low Vision Clinic located on the campus of the Maryland School for the Blind. Highly qualified licensed specialists use the most updated technology as well as activities that are fun and engaging to evaluate the student's visual performance. They look at the student as a whole, not just from the ocular aspect, but they also review such things as neurological reports and teacher information. For me, it allows me to organize and plan activities and materials to support my student during their education. Families also walk away with information and knowledge to also help them. If you haven't got a good resource, look at the Low Vision Clinic at the Maryland School for the Blind. As a teacher for the blind and visually impaired,
And we always get a little bit of second play there, an instant repeat. So with that, thank you for those testimonials from teachers and optometrists and families. Now I turn over the microphone to Miriam Malaur, the chair of the board of directors for the Maryland School for the Blind.
Thank you, Rob, and good evening all. On behalf of the Board of Directors of the Maryland School for the Blind and the entire MSB family, I want to thank the Maryland Society for Sight for their very, very generous donation to the school. We are saddened to see that the Maryland Society for Sight is not going to continue in its past form, but we are very, very excited that we will have you continue as the Maryland Society for Sight Low Vision Clinic at the Maryland School for the Blind. And we hope to continue your legacy of accomplishment, which we are in awe of for the past 110 years. And we pledge to do our best to preserve and continue your mission. So thank you very much.
And now we'll hear from Sharon Whited, low vision specialist at the Maryland School for the Blind.
MSB offers monthly low vision clinics on campus and in counties throughout Maryland upon request. There is no charge for our services, and our services are available to underserved populations who have been unable to get needed community-based services. We provide a team approach to assessment with the student, parent, and teachers, active participants, along with the MSB social worker, optometrist, and low vision specialist. Very often, the low vision clinic is the first step in a long-term relationship with MSB, whether they participate in activities provided through the outreach department or attend MSB for intense instruction in the expanded core curriculum, a specialized set of vision-related skills for students who are blind or visually impaired. We are dedicated to helping students reach their potential in educational, leisure, and vocational activities, and look forward to developing new pathways for meeting the needs of visually impaired students and their families. Thank you again for your generosity.
All right, if we're ready, we're going to do the ribbon cutting, and we're going to unveil the plaque, which is in commemoration for this tremendous gift, which is more than $400,000, which is one of the largest gifts we have ever received in a singular gift of this nature. So what an amazing gift. And thank you for this, leaving this legacy with us. Kind of my closing words right now. Thank you for doing this for us. And we're going to now cut the ribbon, and I will read the wording on the plaque. So if you pull it apart.
Pull it down.
Oh, there we go.
Low Vision Clinic.
Oh my God.
I will just read it. The Maryland Society for Sight Low Vision Clinic at the Maryland School for the Blind is dedicated on this 27th day of January 2021. Upon the dissolution of the organization, the Executive Board of the Maryland Society of Sight for Sight is proud to continue its 110-year mission to preserve and protect vision for all Marylanders by supporting the Low Vision Clinic at the Maryland School for the Blind. The Maryland School for the Blind Board of Directors, staff, alumni, parents, and students are grateful to the Maryland Society for Sight Board of Directors. Samuel Bowles, MD, Mary Louise Collins, MD, Lisa McGinn, OD, Audrey Novak, Michael Sless, OD, Daniel Stoltz, OD, Chris Trapani, and Dr. Joanne Wolterman, MD. Robert Hare, Superintendent, Ruth Ann Hinson, Director of Statewide Outreach Services, and Marion Malaur, Board Chair. Thank you, everyone. Once again, what a special and peculiar dedication ceremony.